So here we have another case with some crowding. The relationships are quite good. So the strategy here would be some expansion in IPR. But before proceeding to the virtual setup step, let's check the roots axis. Since I'm going to just expand the posterior teeth without rotations or some mesial distal movements, I position the axis this way so that the teeth, they just expand, nothing else. When we use this tipping movement, they don't go mesially or distally, just buccally. So here we can adjust it a little bit, position it more in the center of the crown. So I always start with this step to check if my technician set all these axes correctly and adjust them as I want them to look like. And here I check that the central rotation is placed in the middle of the root. I see pretty long roots, so it will be so hard to move these teeth because we'll get a lot of resistance. Now I'm checking the mesial distal position of the virtual roots, and so for incisors and canines, I position them along the root of the teeth, but for the posterior teeth here I ignore the anatomy because I'm not going to do any movements, just buccal tipping with preservation of the rotations and all the minor imperfections. And now let's check that virtual torque. I think it's quite okay. So it was the lower arch. Now let's check the roots on the upper arch as well. Starting with this point of view. And making the virtual axis look towards the buccal direction, despite the anatomy we have. But for the frontal teeth, in this case, we are more precise. Trying to position the roots as more accurate as we can, following on all the teeth rotations. Well, now let's go to the side view. So here we are ignoring the anatomy because we're just going to expand, nothing else. Wow, so big roots. It's gonna be a hard case. It might look simple because it's just a regular crowding, but we have to be very accurate with the roots of this size. We'll reduce all the movements down to some very minor meanings, numbers. Well, what else? Now let's check the torque. I think it's okay. So now we can proceed to the virtual setup. Since we're done with the roots, let's dive into it. So here we have crowding on the lower arch, and let's start with trying to fix it. So let's expand. I don't expand the third molars because it's just not possible with the aligners here. We can even move them a little bit lingually to create more tension in the aligner. I think we should remove the gingiva, remove the transparency on the bone to be able to see if we are still inside the bone or we are already outside of it when moving the teeth. So once we expand, we start to see some gaps, and we can close it with a couple of instruments. The first is rotation, and the second is distalization. But we cannot distalize more than 2 teeth on each side simultaneously, so we need to divide those movements to a few layers if we want to distalize more than 2 teeth on each side at the same time. I'm not sure if it's imperfections of the accuracy of the CBCT scan or it's real image. We'll check it later. So at layer 1 we expand with some overcorrection so that we see some gaps between the teeth. It's okay. We always remember that aligners don't work for like 100%. They always work for 95, 80, 85%. So if you make the movement like this, it will be more like this in the actual in the real life. Well, we did some expansion here, and let's move to the upper arch to adjust the contacts before we could proceed with the lower arch. Let's remove the gingiva and remove the transparency of the upper bone of the maxilla bone. We expand, we rotate, and we always combine the rotation with some inclination so that the rotation can work for real. Let's add some palatal tipping to the third molars to get some more tension. I think now it's time to make some distal movements of the premolars. We'll move second and first premolars at the same time, but we're not going to move the canines at this stage. Let's check how it looks now. Yeah, I think the occlusal contacts are fine. Get some sagittal gap, which is okay for this stage. I would even increase it a bit. So here we also add some distalization, some distal tipping. It's not a bodily movement in this case. By the way, pure bodily distalization usually doesn't work for the mandibula, especially for the roots of this size. Of course, it's just impossible to achieve the translational movements. Well, can we reduce this tipping? I think yes, we can. Let's reduce it a bit. We still have some gaps, which is good for us. Well, let's create the layer 2 for both arches. And at layer 2, I'll move the canines more distally and lingually. To put them more inside the dental arch. Yep, something like this. And let's get to the upper jaw and do the same. Check the contacts between the canines. I think we should make them more tight. Well, and I think it should reduce this inclination. So since I did it at the layer 1, I had to repeat it at layer 2. You can do it by clicking just this reset to position. Restore its previous layer. Well, we're done with the canines and molars and premolars. And let's finish with the incisors by creating the final layer. Let's just distribute this space between all the teeth. Here I don't like the torque, so we'll add some lingual translation, but I'm not sure if it can work for real, because we see the root is too long. But we can try. It's not a big deal for us to make a trial. Let's turn the gingiva on and check the overcorrection. So here we see that the central incisor on the right side, it was more labially. Now we should put it more lingually to get some overcorrection. And the same for the rest of the teeth. I thought that the IPR would be bigger in this case, but now I think it's not that big. Maybe 0.2, 0.3 millimeters between the teeth. And now, yep, I think we should add some intrusion. It's obviously here. Yep, looks better now. I think this is just an imperfection of the scans, but for sure we should expect some black triangles. For this case, it's normal if we got some. We can reduce them by adding more stripping, more IPR, but we can make the decision once we get to this final stage. So now let's create the layer 3 for the upper teeth and recline them. I would recommend veneers for this guy. Okay, let's turn the gingiva on. You can add some more palatal tipping to the canines. Of course, I would like to improve the torque, but it's not possible with this length of the roots. So we are very limited here. Okay, let's distribute the space, reduce the sagittal gap. For the incisors, I think we can improve some torque. At least we can try. So when we combine the pure translational palatal movements of the incisors with some intrusion, we usually don't need the power ridges. This is what the studies say. Here I'm not sure, should we align the incisors more evenly with the gingival beneath or with the incisal edges. So we'll show this to the customers and ask them what do they want from us. Some sagittal gap is okay here. Okay, let's stop at this point and get some attachments. So I always use this kind of retentive attachments. If we make an intrusion of more than 2 teeth, I would place at least 4 attachments for that arch. So here we intrude all the incisors, so that we need to have at least equal number of the retentive attachments. As many as many attachments as many incisors we intrude. Maybe it's just an overprotection, but I'll place some other retentive attachments. I think we'll not bond them to the teeth in the real life, because the retention should be okay. But to be sure that in case if the liner fits loose, we can always bond the attachments to the molars. Well, don't forget the digits. And I think it should be a good idea. It's going to be a good idea to put the negative attachments here on the layer 3. So let's first set the attachments for all the layers and add some attachments to the last layer. Don't forget to make them look red. That means that they look inwards. It's called negative attachments here in Maestro. Do we need some attachments for the canine rotations? Yes, we definitely do. 3 of them. I usually use this kind of triangular attachments. So if it looks to the mesial direction, yes, it does. If the rotation is to the middle direction, we place it more to the mesial part of the teeth. Let's reduce the size. Well, here we have mesial rotation as well, and here the same. Set for layers, set for layers, set for all layers. Still get some gap here. Let's check if we need some more correction on the upper teeth. I think we've already done it. Maybe we should even reduce the degree of the correction here. Let's check the attachments between the layers. Are we correct? Yes, we are. Now let's go to the models builder module. I'd also start with the lower arch. because the treatment on the lower arch should be much longer. Well, let's set the distance for 0.2, because for the regular case I would set it maybe 0.25, but here with these huge roots I think 0.2 is fine. Maybe we could even reduce to 0.18. So here we're moving the canines lingually. It can be done a bit faster. Let's check what the rotational degree. 0.77, it's fine. And here's some intrusion for 0.19. Let's reduce it. I think it should be a good idea. And let's reduce this amount as well. So we get 24 aligners for the lower arch. And it would be great if we make the same quantity for the upper. I prefer to match the numbers between lower and upper arch. And here we should make more and more aligners. 0.18 is fine. And I would definitely use Endura FLX for this case. We need a good material. Here it's fine, 0.22. And here we have retraction and some intrusion. Let's make 10. And if I was correct, it's 24. No, it's 25. Yes, we can reduce the quantity on the upper arch for one tray. I think we can do it at the layer 2 or 3. Yes, I think here it's fine to make the step equal to 240 microns per step. So now it's 24 sets of trays. Now we are exporting this case to the cloud. And let's open the cloud. This is a very cool feature of the new Maestro version 6. The ability to use the cloud for the uploading the cases you've done, to show them to your customers, to the patients, to doctors you're working for. And let's find it in the list. Where is it? It's on the second page. Yes, that's it. So now we get a direct link which we can send to our customers so that they can see the setup from any device, even the smartphone. Unfortunately, we cannot see the roots in this viewer, but maybe they'll update it in the nearest future. So we can start the animation. And check all the movements. Check the final position if you like it or not. Okay. Thanks for watching.